So my group described the overexpression of CD47 in patient samples with myelofibrosis. And we also described a reduction in calreticulin expression in those patients. Now, calreticulin and CD47 works in contradiction to each other. So CD47 is a anti-phagocytic signal. So it's a message of do not eat me to the immune system. So normal cells regulate their self-renewal and life expectancy on the basis of communication with the immune system. But cancer cells, and that's been documented in solid tumor, tend to protect themselves overexpressing CD47. What they also do in solid tumor is overexpressing calreticulin, which in contradiction message a signal of eat me, so a pro-phagocytic signal. But the ratio between the two sometimes might lead to a different destiny for those cells. In myelofibrosis, that doesn't seem to be the case. So in myelofibrosis, we have an overexpression of CD47 and a reduction in calreticulin. So the anti-phagocytic message seems to be prevailing. So in vitro assays, we demonstrated how impairing CD47, for example, using a monoclonal antibody specific against the CD47, increased the apoptosis and cell death when cells were incubated with cytoreductive drugs. And we use Ruxolitinib in vitro because clearly it's one of the most used drug in myelofibrosis. And what we noticed is that there was an increased number of cells dying in vitro when in combination with Magrolimab, which is currently the one of the anti-CD47 monoclonal antibody in clinical trials, but not in myelofibrosis. So there is a bit of a proof of concept that we believe targeting CD47 has potentials in treating patients with myelofibrosis, perhaps in combination with other drugs.